Reactive arthritis and Reiter's syndrome, which is a form of reactive arthritis, found on page 699 uh, and 700 into 701, um, are fairly common things. They're spondyloarthropathies, and they're defined as an acute aseptic inflammatory arthropathy arising after an infection, and it's found at a joint remote from the primary infection. So this isn't septic arthritis. Septic arthritis is when you have an infection that infects the joint and therefore causes inflammation and arthritis in that joint. So this reactive arthritis happens when people get things like Campylobacter jejuni, which is a gastrointestinal tract, or they get Shigella dysentery, or they get Clostridium difficile, um, uh, you know, in the digestive tract, and end up with inflammation in joints uh, as a result of it. Another big thing is chlamydia pneumonia in the respiratory tract, Yersinia, various things like that. So it can be in the GI tract, it can be in the um, in the genitourinary tract. It can be in the respiratory tract, and it all happens. Uh, it happens, and writers is a very common one. Now, other diseases can cause arthritis, like HIV and Lyme disease, Epstein-Barr, rheumatic fever. They all cause arthritis, and that's not really considered uh, arthritis, um, or reactive arthritis. Rather, and they're dealt with those diseases. When you talk about Lyme disease, when we talked about HIV, that kind of goes. Reactive arthritis usually happens in sexually active people because it often follows uh, genitourinary tract infections. Um, so Reiter's syndrome is the big one. So it usually follows an STI or some sort of a dysentery, and there really isn't a lot of diagnostic criteria uh, to this. There's so when is it considered Reiter's? It leaves something to be desired. The target population often doesn't have family doctors, so it kind of goes underreported, and they'll see numerous doctors for the same thing. Um, Oftentimes it's fairly mild, so again, people don't seek treatment for it. They might seek treatment for the VD, and that's about it. So peak onset is in the third decade, it's in the 20s. Um, and it usually has to have some sort of venereal or uh, digestive system problems. Uh, um, it's primarily an inflammation of the synovial membrane, and you get erosion at the insertion of the ligaments and tendons. Um, so what these people get and is urethritis, uh, conjunctivitis, and arthritis. We used to say they can't see, they can't pee, and they can't bend. Uh, I don't know why those three things seem to go together, except that they all have a lot to do with collagen. And so that's probably the triad. So in order to have it, you kind of need this triad. Um, Knees and ankles are big. Can't be, can't see, can't kneel. Uh, so sometimes there's skin lesions, so it looks like a lot like psoriatic arthritis. It looks like psoriasis. Sometimes it's just low back pain. And so it's kind of a little bit all over the map. An interesting thing that just happened to me this summer is I had a patient that had a bad urinary tract infection. She had conjunctivitis, and she started to have this acute, uh, really acute arthritic things in her knees. Um, and I suspected this, so we talked about it, and I told her to go to the family doctor. Um, and get it looked at. And he kind of concurred. He thought it looked like Reiter's as well. And he sent her to Sunnybrook, to a specialist in Sunnybrook to get it looked at. And when she arrived, I had said Reiter's, and her family doctor had said Reiter's, and she met with the specialist. And so she said they suspect Reiter's syndrome. And this guy got really upset and really mad at her and kind of told her off. She reported back to me. I guess he was a Jewish doctor wearing a yarmulke and that kind of thing. And he told her that Reiter, the guy that first named this disease, was a German doctor working for the Nazis, and he refused to use that name. He just called it reactive arthritis, and that was the name that it was going to be referred to in his clinic. Um, that's the first I had ever heard of that. I don't know if that's true or if it's not true. I have to assume that it is, but it was just in August that this woman reported back to me that this is what it was. Now, she didn't have a venereal infection. She ended up having, like, she had a urinary tract infection, but it was remarkably similar. She had the triad. Um, it does seem to have this autoimmune attack on these these places. One of the things that's also interesting in reactive arthritis is that if it gets into where the tendons meet the periosteum, it can lead to heterotopic ossification. Now, that's only something I've read about. I haven't actually seen it in practice, but nevertheless, it's something to be aware of.